Welcome to another episode of American Iron Podcast. Today we have Dr. Jeff Webster. If you want to introduce yourself.
Yeah, I'm Jeff Webster. Gosh, been a member of American Iron now for probably at least 20 years. My second home. Been here in Reno 33 years.
So,
Orthopedic surgeon.
Yeah, talk a little bit about your practice, kind of what you do and what your superpowers are. You definitely have some.
Yeah.
A lot of our members think so anyway.
Oh, that's nice. No superpowers. Well, it's evolved over 33 years. First started in 1992, was with a small group, not the Reno Orthopaedic Clinic. It's a small group, Glenn Miller and I, and that eventually built up to about 4 or 5 of us over about 20 years. Anyways, I was, doing a little bit of everything at the beginning.
Yeah.
Trauma, pediatrics, club feet type things, all kinds of stuff. Hands, necks, elbows, whatever.
Uh-huh.
And then over the years, my practice is narrowed in its focus. Now I just kind of do what I like to do and what I think I'm good at.
Which is?
So, a lot of knee surgery, knee replacement surgery, knee ligament reconstruction, knee arthroscopies, shoulders, ligament and tendon reconstructions.
Yeah.
Some hand stuff. But it's nice. I kind of spoiled. I have a gentleman's practice, I would call it. I just get to do what I like to do.
But that's good for the patient.
Yeah.
Because, they're getting to receive, your superpowers, right? So I can tell you, we see a lot of people, because we have a lot of high-end athletes that come to the gym. Not just normal populace, although we do have a lot of normal populace too. But our athletes demand a lot in their body. And all athletes get injured.
Sure do.
And the ones that have gone to you, including myself, for shoulders have had phenomenal results. Coming back stronger than they were before the injuries. You do, I don't know what you do different, but the outcome is different.
Well, that's nice to hear.
Yeah, for sure.
And
So,
I don't know if I do anything different than the other orthopedic surgeons in the area. I know I don't rush my surgeries. I always take my time.
Yeah.
But I'm pretty efficient with the time because I've done, so much over the years. I kind of stick with the old tried and true treatment. I don't necessarily have to be at the leading edge of technology or with little new tools, to play with, so to speak. I like tools, but gosh, if something works real well, I don't tend to go too far from that.
You're making it sound very caveman-like. Just have a saw, like Civil War.
have you seen the tools they use in orthopedic
I've
surgeries?
only seen like the hammer that they bang into stuff.
Go look in Bob's garage. It kind of is very similar to
All the tools.
Yeah.
And Brandon, we call it a mallet. It's even more cavemanish than you think. A hammer, that's a sophisticated word.
right?
Just mallet,
I'm
chisels,
Yeah. Saws.
Yeah.
Yeah.
You guys really getting that down and dirty with it?
Uh-huh. Yeah.
Describe it.
Well, it's neat stuff. It's kind of hard to describe in words. I've never been very good at describing my thoughts in words, but one, it's very delicate, surgery is. You want to be very gentle with tissues, because if you're not, that can lead to infections and healing problems. But yet you got to get the job done with certain tools like, mallets and chisels and drills and saws. You need some pretty neat tools to utilize those old instruments, but you put it all together. Yeah, it's gentle, but it is very forceful, sometimes kind of cavemanish, especially if anybody's seen some of these surgeries on YouTube.
Like I said, I've only seen like banging rods into people.
Mm-hmm. And that's pretty impressive when you see it. It's like, oh my gosh. And thank goodness, the human body can take a lot of punishment and recover. It's really remarkable. You can beat somebody up and they come out better in the end. It doesn't seem intuitive. As long as you do a good job of what you've been trained to do, you can really profoundly affect somebody's life in a good way.
Yeah, for sure. Especially our people that demand a lot from their bodies. This is a big part of their life and whatever their sport is.
Yeah, and I try to get them back.
You do
to
get 'em
that
back.
level.
You
The
do.
last thing I'm going to say to somebody, it's a regular here at American Irons, just for them to stop lifting. Well, they're not going to listen to me. They're going to be
No.
ticked off. Oftentimes, you kind of ruin their day or a part of their life. So I always try to encourage them to be active.
Yeah.
You make them a little better. Maybe they have to modify how they lift things in the gym, but want to get them back.
Yeah. Yeah. Fully. And you do. You do.
Mhm. Yeah, I try to.
It's been amazing to watch. So one of the questions I asked Dr. Jones was, you guys all seem like muscle heads. I mean, not. Those of you that right, yeah. you're an athlete, he's an athlete, you're an athlete, and you guys are very accomplished, almost extreme athletes. You're not just run-of-the-mill athletes. One of the questions I asked him is why are so many orthopedic surgeons athletes? And his answer was because all athletes get injured, and so that probably had a play into where you went with your medicine. Do you think that, or do you have a different thought?
To some extent, I think that's a variable. But actually, I think, at least more importantly for me, is that orthopedic surgeons in general, they seem to be jocks.
Yeah.
You know, classically, it was a good old boys club, so to speak.
Okay.
And they all were athletes in general. In fact, probably 50, 60 years ago, historically, per my understanding and reading, is that the orthopedic surgeons, they were kind of the dumb ones in the medical school class.
I guess that makes sense, though.
Yeah, because, everything back in the
Banging
day,
on shit.
it really wasn't, surgery was mostly casting, traction, old kind of,
All right.
old stuff.
Not that way anymore.
No. And then in the 80s and the 90s, it started to change. All of a sudden, for some reason, orthopedics became very, very popular, very competitive to get into.
Oh.
I'm not sure, maybe because of reimbursement. At the time, orthopedic surgeons were paid quite well. That's not so much anymore. And all those old jocks, they just kind of, they kind of picked people like themselves, I think. So you have somebody like Jones, or I come through maybe some athletic history, college athlete or something. That was always a positive thing for your, curriculum vitae or CV.
It's a really good thing for our clients, your patients, because you understand prehab and rehab. You understand recovery, and you understand how important. People don't have to come to a gym to recover, but they have to move.
They sure do.
And you have to move correctly.
Mm-hmm.
And you guys understand that and respect that more than I have seen with any other type of practice. The importance of moving.
Yeah, because if they don't move, all that effort we put in to fix them is kind of wasted.
Yeah, for sure.
Yeah. So I try to tell my patients, we're a team. We got to work together. I'll fix you. I'll reattach your tendon or replace your knee joint. You got to make it work.
Yeah.
You got to find some way to do that. Go to physical therapy, go to the gym, hire a personal trainer, go online. Yeah. Try to really encourage that big time.
How common is it for people to just not do that?
I'd say 15% of the time.
15?
They're not going to follow our recommendations. They're going to fall way behind.
That's not a lot, though. That's a fairly small percentage.
Yeah,
so that's good. That's good.
Yeah. Most seem to comply. Those that don't, they kind of learn the hard way. You replace a knee and they don't go to therapy. They don't put that effort into rehab. And they come back to see you in the office like a month after their surgery and they can't really bend their knee. So you got to take them back to surgery, sometimes do a manipulation. Or sometimes even if they put the effort in, something doesn't click upstairs. So you got to go take them back.
That's reassuring. In case I ever need surgery. It just might not work.
Well, these guys had to manipulate my knee.
Because, pain is powerful. My goodness. You know, and I know. You and I, we've been through our surgeries.
Yes,
it's not easy. And sometimes it's hard to break through that pain barrier. And those that can't, they really struggled, and then we have to intervene and do something else. And thank goodness there's always other options. not all is lost if somebody doesn't, follow your recommendations.
What do you mean by other options?
Well, we can, like say, somebody doesn't move a knee after surgery, gets really stiff. Well, we can move it for them in a way that it doesn't hurt them. Get their motion back, so to speak. Not all is lost.
They put you under and they force it.
Okay,
Yeah, we can play caveman. We can rip some scar tissue.
that makes sense. I was like, that sounded very cryptic.
It's brutal. But it allows you to move your leg and at least start on a decent recovery,
What is manipulation exactly?
That's basically where you take somebody's extremity or joint and force it through a range of motion.
Oh, like you were saying.
In such a way, hopefully you don't fracture the bones around the joint, but you just want to pull or rip the scar tissue.
How do you guys do that?
Very carefully. And under anesthesia.
That makes sense, yeah, under anesthesia.
It's like, for example, a knee, which is probably the most common body part that we would have to manipulate after surgery due to stiffness. So we have to be very careful and push on the knee, not down at the foot or the ankle, because the lever arm, you look at the leg from the knee. If you push down here, the amount of energy you can create through that pulley effect through the leg is huge at the knee. But so you push up here.
That makes sense.
Push up here on the upper leg and force it to bend. And that way you don't have as much of a lever arm, so to speak. You don't create quite as much torque. That way you don't have to worry about fracturing, a femur or tibia.
Especially one that's already been fractured.
Yeah.
So.
Yes, we're always a little bit nervous when we do the manipulations, because there's a fine line you have to follow. Yeah. You go too much, you harm them. If you don't do enough, well, you don't get them the flexibility that they really need.
I'm just imagining it making a ton of noise.
And it does. In fact, when I do, I put my ear right up to the knee, and I have my hands in there, so I can actually hear the ripping and the tearing of the scar. And it's a wonderful noise, and you think, gosh darn it, I'm here for the right reason. It's like we're doing the right thing. But you don't want to hear, like a crack, and then
you want to hear a rip.
And then have a leg bone or a thigh bone bust. And you just want to hear that, tearing of scar tissue. It has distinct noise too.
It's like popping bubble wrap.
Yeah, exactly. I was just going to say that, as a matter of fact. Yep.
My question is, when you have injuries, say in a knee or a shoulder, and you have to manipulate to get that range, how much jeopardy is there to damage those ligaments and tendons? Because there's probably already some damage in there, right?
There is.
So.
Yeah, there's that risk is there. Fortunately, knock on wood, I haven't had that happen to me. Ripping somebody's tendons, like the quad tendon or the patellar tendon. Again, it is a controlled, amount of energy you're putting through that body part. You're just not going as hard as you can. You start out real gentle. You're listening and you're feeling for the tearing of the scar. So if you're not getting any noise, you're not getting any response. You got to push a little bit harder.
Right. But
it's a real gradual thing. That way, the tissues have some time to respond to that, so to speak. Yeah, that'd be a disaster to rip somebody's patellar tendon or quad tendon or fracture.
Yeah.
Because it'll set them back. It'll make them worse than they were before the surgery.
For sure.
Do you notice a difference between like athletes and non-athletes?
Oh yeah, absolutely. It's great to have athletes because they tend to be self-motivated. They already have an understanding of what hard work is in respect to physical things, and so they'll push themselves more.
At least, like, what about pain? Because I imagine athletes have a way higher pain tolerance.
Yeah, usually, but not always.
How does that affect the recovery process? Say someone has a very high pain tolerance versus someone who doesn't.
Yeah, so somebody has a very high pain tolerance, and it actually turns out to be true, because a lot of patients will come in and say, gosh, doc, I've got a really high pain tolerance. No problem. I'll be able to recover real quick. But you find out that's really not the case. So you never know for sure. You kind of find out after surgery. Those that have a high pain tolerance, they do extremely well. They recover probably twice as quick. As somebody that does not have a high pain tolerance. It does seem like athletes, for the most part, do have a higher pain tolerance than non-athletes.
What we've seen is pain tolerance is selective. So example is some people have, and maybe it's a protective mechanism, but some people have a super high pain tolerance to, say, an upper body injury, right? Where they were just able to just drive through it. But when it came to an ankle or a knee, their pain tolerance was so much less. It felt so much more intense to them, the pain.
And I've seen that, and hard to understand why that is.
Okay.
I think everybody's wired differently.
Differently, yeah.
You just never know how each individual's going to do.
It kind of makes sense, though, because that's how people are with like tattoos.
Is that right?
Some people like certain spots, they'll be like, it's the worst pain ever. And then another person will get that spot and it's like, they don't feel it.
Yeah.
And
and I always wonder how much psychology has a play in that, with an injury, that pain is just a trigger of, hey, I have a bad injury here and I'm protecting it and I'm not pushing through it.
It's when I see it, I always try to tell the patients that, hey, don't worry about the pain. It's normal. You just had a huge operation. You're expected to have pain, but you got to do your homework anyways.
Yeah.
You got to work on your range of motion. I understand it hurts, but do it anyways. If not, they don't have to take you back to the operating room, in 6 weeks. And a little scare tactic doesn't seem to hurt.
What about people that push it too far? Their pain tolerance is just so high they don't care.
Yeah, occasionally that will backfire. Not very often, but occasionally somebody will overdo it and they'll get some like big hematoma, area of bleeding in the area of surgery. And so you have to shut them down for a while. So basically that overabundance of activity early on is for the worst. We got to shut them down, put them to rest for a couple weeks, and then they restart.
That seems like a real pain in the ass.
Yeah.
Or in the joint, yeah.
Yeah.
So that's why with big surgery, I always try. I tend to do a little more hand holding with my patients than maybe some of my colleagues. Unfortunately, I don't have to work anymore. I work because I enjoy it, so I don't have to, do 20 surgeries a week. If I could do 4 or 5, I can. Talk with my patients, review issues with them after surgery. I usually call them the day after the operation, see how they're doing. They know they can call me anytime they have any questions. So that hand-holding helps a lot in respect to maintaining some control of what your patient's doing, if they're doing too much or not enough.
Yeah,
So I like that. I practice is a lot more fun for me now than it was like 25 years ago. When you're so busy, you kind of lose track of what happens with each individual.
That makes sense.
Yeah.
I didn't realize people are having surgery that much.
Oh, yeah. Lots of surgeries out there.
Oh, that.
Well, it's big town. You got probably 500,000 people in Carson, Reno.
And people come into this town from other areas.
Mm-hmm.
Oh, that makes sense. I wasn't even thinking about that.
People come from Elko even.
We have someone coming from New Mexico, to get a surgery here because of these guys' reputation.
Really?
One of the athletes, yeah, on the U.S. team.
Because it just doesn't seem like you would be doing like 20 surgeries a week.
Yeah, some of the guys are doing even more. Now, the average orthopedic surgeon will do 300 to 400 cases a year.
Wow.
That's absurd. That seems like
that's average, but like one of the trauma docs in our group, he'll do 1,000. But he doesn't need to sleep.
I guess not.
Just crazy, man. Yeah, thank goodness for people like him.
Yeah.
Yeah, he's wired totally differently. But yeah, he just loves it. He loves to be that busy. Surgery all the time.
So how many surgeries a day is that, like, typically?
Oh, he could do it probably 10 a day.
And you do, trauma, probably different, probably more in the hospital, right?
Yeah, that was all in hospital stuff, inpatient type things.
Yeah, but you guys, you do a lot of your work out of the rock now.
Correct.
Which is wonderful. I mean, it just seems like the recovery is a lot better. You get to go home, a lot less infection.
Yes, infection rate is very low in any outpatient surgery centers compared to the main hospitals. Yeah, 1/10 the risk of infection in an outpatient center is compared to going to Renown or St. Mary's or Northern Nevada Medical Center.
That's a lot, 1/10.
And I mean, they're doing full knees, full hips, and you're out walking and going home in 2 hours. It's.
Why is it so much lower there versus the hospital? Because that's a big percentage.
Yeah, the numbers of patients that go to the outpatient centers are a lot less than the hospital operating room. So you can control bacterial count, so to speak. You can wash down the rooms better.
That makes sense.
And also, we don't operate on every patient in the outpatient setting. Like if they have significant medical issues, say they had a prior history of infection, as a rule, you're not going to want to operate on those people in an outpatient setting. So you're kind of picking the best patient candidates for surgery to go to an outpatient center. Anybody that has a risk for infection, they tend to do them at the hospital in case something, proverbial crap hits the fan.
Oh, that makes sense.
Yeah. So the outpatient service center, usually specific criteria that a patient will need to meet to have their surgery done there. Whereas a hospital, basically, they'll take anything.
Yeah.
Doesn't matter how sick they are.
Yeah.
If you have a trauma patient, on dialysis, whatever, had a heart attack, you can operate on those people in the hospital, not at a surgery center.
And people are in the hospital because they have other, viral or bacterial infections too.
Mm-hmm.
So, I mean, there's a lot more of a load there, right?
Yeah, the bugs are a lot worse in the
Yeah,
hospital
for
compared
sure.
to an outpatient center. And patients that have bugs, say they have a current infection, the surgery center is not going to let you take that patient back to that surgery center. You have to do the work at the hospital.
That makes sense.
Yeah.
And all the specialists are at the hospital. So you have an infection, you got an infectious disease specialist there, renowned, who can step in and consult in the case. Patient has a heart condition, say post-op and recovery room, something's going funny with the heart. Well, you call the cardiologist on call. They can come in and consult. Where you don't have that option in the surgery center.
Okay, yeah, that makes sense.
Yeah.
That's why people are less angry at The Rock.
These guys' staff are amazing, and what's wonderful is the staff there follows suit. There's a lot of athletes that work
Yes.
at The Rock, and
nice.
What's really nice is as a patient, you're in post-op and you're coming to, and the person that's taking care of you in post-op gets what you're going through because they've had an injury. They're an athlete. They know what it's about.
And they work out at American Iron.
And they work out in the
The last time I was there, I saw someone from American Iron.
I see a lot of people from American Iron there.
Yeah, nice thing about the Rock Surgery Center, they've culled the best people, the best employees from all the hospitals.
Yeah,
So the best work there.
truly.
Yeah.
It's really nice. It's an incredible environment.
Because all the surgeons in the group, they're strong, and they know what they're doing. No, not a whole lot of BS that goes on, not a whole lot of wasted time.
Right.
So it's a really nice place to work.
And they want a high caliber person working with them, right?
Yeah.
To be able to be effective and efficient in what they do.
Yeah, nobody wants to end up in the courtroom,
Yeah.
because of mistakes being made.
Right. But you guys also want the best for your patient.
Oh, yeah.
And that's your, you seem to all be very, very focused on how can we
Yep.
create the best outcome. So
Yeah,
you don't.
Yeah, we don't like getting calls in the middle of the night. Jones especially.
You're gonna have to cut this out, but my God, it would interrupt the 2 or 3 scheduled he has for that night, right? Sorry, Jackson, but
No, we always
reputation precedes you.
Yeah, we really truly hope for the best for our patients. We don't like complications.
Right.
A huge inconvenience for the patient.
Yeah.
And my goodness.
So, let's go back to you. You're a pretty accomplished athlete. I think one of the areas that you're very accomplished in is swimming. So, tell me about that.
Just a little bit.
Oh,
I mean,
national levels. Yeah.
well, yeah, I've been to U.S.
Yeah.
Masters National.
Yeah.
And the idea there with Masters swimming, you just want to outlive your competition.
It's powerlifting.
I say the same thing about powerlifting.
That's
It's
powerlifting.
simply a game of attrition.
Yeah.
Right?
So I become more competitive the older I get because all my competition is,
Yeah, but you
stop swimming
you
or
train your ass off.
yeah.
Yeah.
Well, I've always liked hard work. I'm not afraid of that.
I mean, not only in the pool, but in the gym.
I think it must be the endorphins. It must secrete certain endorphins that make me keep going at it like I do.
Yeah.
Yeah, I enjoy swimming. There's something peaceful about it. Same with lifting weights. People probably look at weightlifters and gosh, how is that anywhere close to being peaceful? But it just is.
Oh, it is. Yeah,
It's
it's a lot more peaceful for everyone else around us when we lift weights too.
Mm-hmm.
It's safer.
Yeah, exactly. Start getting stir crazy.
Yeah.
But yeah, I swam as a kid, age group swimming. Back in Ohio where I grew up, our high schools, at least were in my part of Cleveland, the high schools didn't have pools, so you had to swim on a club. So it was an AAU sanctioned, swim team.
Nice.
And then high school didn't have a team, so did the AAU thing. I walked on at Utah. I went to Utah to ski because of my passion for skiing.
Uh-huh.
And got a little bored with college after a couple of years. So as a junior and senior, I walked on the swim team. I wanted something to do. Need to add some spice to life, so to speak. And that was a great fun part of life. Very hard work,
Yeah.
but still, have lifelong friends from that experience.
Right.
Just a lot, being on a team, I think adds a lot to a college experience.
Yep. To life.
Yeah.
That's what we have found with the vet programs that we run, being able to create that team and have them, train together and then compete in a competition together is amazing for their recovery, both physical and mentally,
I think it's important for just individual sports in general. If you can find a team, like an individual sport, but you're on a team, it seems just to breed way better athletes.
I agree.
I think there's more competitiveness, but there's also more camaraderie,
support,
less bickering.
Mm-hmm.
I'm just not a fan of team sports. That's just what it is. That's what it boils down to. I just don't like team sports. It just seems like there's a lot of ego involved versus something like swimming where you're more worried about yourself rather than the other people, right?
Mm-hmm.
Exactly.
What were your events? Yeah.
I was a sprinter, so short distance, butterfly, and freestyle.
Okay.
That was my thing.
Hence the back.
Yeah. Back to I set a new PR this morning in the gym with my
With your
pull-ups. Yeah.
And what was it?
62.
Holy
Jesus
shit.
Christ.
I know.
I can do 10 maybe.
You're a big guy, man. You're all muscle. I'm just this old skinny guy.
No, you are not.
I can pull my body weight up pretty easily.
I'm gonna embarrass the hell out of you. So we had an employee here that he no longer works here, but he opened in the morning. Jeff used to train in the morning, and I was behind the desk, and he walks out and he goes, he goes, "Now I'm not gay, but have you ever seen Jeff naked?" No, no, I have not. He goes, "Oh my God."
Mad respect.
Yeah.
Why does that keep coming up?
I thought it was hysterical.
Oh, kind of a bad joke. It's, hey, Webster's in the shower.
Yep. Check it out.
I mean, I've walked in before. I just didn't say anything.
You didn't run out to the desk and go, "Oh my God."
No, I admired from afar and then blocked it out of my memory.
That's good. Yeah, that's good. Thanks, Brandon. I don't think I'll ever live that down. My goodness.
No, I'll make sure of it.
Where were we? I lost my train of thought now.
So, just talking about freestyle and butterfly, and more of a sprinter, which makes
short
sense
distance.
with your strength in the gym. That fast twitch.
It was really frustrating in college. The preseason testing. Vertical jump, running, strength. How many bench presses you could do. I was always the strongest, but it didn't correlate to performance in the water. That was always frustrating. I might have been the best overall measured athlete when it came to actually turning on the jets in the water.
Right.
Yeah, something happened. It's like why is the big guy that's half fat? How is it that he can beat me in a 50 freestyle than me? But there's actually some there's some gift that you're born with.
There's also buoyancy factor.
Buoyancy
right?
factor,
when you're super lean, you're working twice as hard to stay, in a in a plane.
But
right?
probably like powerlifting, a lot has to do with technique.
Oh yeah.
Subtle little details that maybe my stroke is not as efficient as the superstar on the team.
Speaking of your bench.
Yeah. That's a thing of beauty. It's like It's one of and then I'm the only person
one of a
that
kind. It's very unique.
What's going on with your bench?
just as long as you don't walk too close by, because my legs are usually up in the air. One or the other's kicking in different directions. You know.
You doing like bicycles? Well,
He is. He does.
So
Yeah.
I've always, lifted my feet up just to kind of protect my back, because my back is prone to some, being pulled once in a while. Yeah, so a bench is not pretty.
I mean, it sounds like a big core stabilizer.
I
Maybe.
I have
yeah.
nothing. I have nothing.
No, is it like just flat back and then like feet straight up? in the air?
Feet up. At the feet, because one shoulder is a little bit off compared to the other. Things are starting to catch up to me, and so I'm totally out of balance. So one leg will be different height than the other.
With all his back strength, he uses no back in his bench.
Oh man, could you imagine?
I know, absolutely. With his ability to engage, especially with the pull-up, because that's the exact, that scapular retraction that you need for the bench, right?
Yeah.
Out of the hole, nothing.
What, are you
And I'm okay with that.
Are you all just shoulder?
It must be.
You're gonna have to do surgery on yourself soon if you keep it up.
Mm-hmm. The shoulders are going. I can tell the ratcheting noise they make, and but I'll just try to get as much mileage out of them as I can.
I have a great surgeon for you. It'd be kind of hard to do it on yourself, though.
Local anesthetic. That's all you need.
Yeah.
And maybe just a little bit of normal anesthetic for yourself.
Well, good.
But yeah, being on a team is good. You go back to the team. Yeah, I like being, because swimming is solitary for sure. Before I joined our local masters team, I would swim by myself every morning. And I'd just go to a pool down there at the Double Diamond Athletic Club, and it was called that. And my day would start pretty early, so I'd get in the water and swim an hour from 4:30 to 5:30 in the morning. That way I could go to the hospital, make rounds, go to the office or to the operating room and do my work. Then I changed my schedule, joined the masters team, and that's been a lot more fun. Definitely a lot stronger swimmer now, swimming on the team, even though it's still an individual effort. You got your buddies on the lane next to you trying to stay up with, just like you guys doing your powerlifting. Mm-hmm. You got one of your buddies that's going to deadlift 7. Well, you're going to have to do 705.
What is it? I always heard if your teammates aren't getting stronger, you're getting weaker too.
Mm-hmm.
And it's because why wouldn't you help them get stronger so you can get stronger?
Mm-hmm.
Do you feel like it made a big difference? Like you just excelled in swimming right afterwards?
Yeah, much stronger swimming now with a team as compared to swimming by myself.
Did you have a coach?
No.
No.
I just get in and I'd swim 4,000 yards straight. Just cruise long and smooth, so as we would call it in swimming. It sure helps to have coaches and teammates because, the sets change. Just like in the weight room, you're going to mix it up a little bit. We mix it up every day in the pool. Yeah.
We mix it up in the gym every day.
Mm-hmm.
Did you have what would be like your training when you were by yourself? You would just do 4,000 each day? That's
4,000 yards, so, 160 lengths straight. No rest, just, hard part was keeping track how to, count to 160.
Right. I don't have enough fingers and toes for that.
It's like, well, you start to think, it's like, okay, where was I?
Where was I?
So usually I penalize myself and do 10 extra lengths,
God,
just because you're stupid enough to lose track of where you were.
What changed when you went to the Masters team?
Oh, coaching and specific, intervals for sets. So you actually have a coach up on the pool deck, writing out the workout on the bulletin board, so to speak, and the whole pool would follow that. So let's say you do, 10 reps of, bench press 225 times. You do that in a minute. And then you rest for a minute, and then you do it again. You do that like 4 times. We do something similar in the pool. So you do 10 reps of 100-yard swims, like on 1 minute and 20 seconds. So you do that as a pool, the whole team, leaving at that same interval.
So very, very similar to, and you change that as you get closer to an event, a competition.
Yeah.
That's
so it makes sense. The same as we would program someone in powerlifting, right?
Yeah. Because I've always wondered, like, other sports, like, what is their actual training like if it's similar to, like, strength sports? Because I know it's more of, like, I guess it just depends, but it's more of like an explosion sport or a endurance sport, isn't it?
Depends on the distance you're going to
Sure.
compete in. So if
Yeah.
it's a 50 yard or 100 yard or 100-meter swim, yeah, it's explosive power, anaerobic, as little breathing as possible. Whereas you have the Katie Ledecky, doing the mile in the pool, that's all aerobic. He's just an absolute machine.
Right.
Totally
right.
different training.
Yeah, yeah. Well, just like a sprinter versus a distance runner, right? They're not going
Yeah.
to train the same, so
Mhm.
same philosophy.
That makes
Yeah.
sense.
So the sprinter and the pool, we're doing a lot with the really high intensity, but quite a bit of rest.
So if someone was talking to you about wanting to add a weight program into their swimming routine, and let's start with someone who's a sprinter, short distance swimmer, what kind of exercises and program would you recommend?
Well, if they're young,
Yeah, they're young.
more of the ballistic, plyometric type things.
Okay.
Yeah. Yeah, swim benches,
Yeah.
So a lot of sport-specific weightlifting tools that would be utilized. You get to my age and, all bets are off. You just do what you can tolerate, really.
Right.
Yes, I must say I don't have a whole lot of knowledge regarding what would be the best weightlifting workout for a swimmer. I would definitely defer that to a, new era coach. Their knowledge is so much advanced compared to mine.
Yeah.
Yeah. But I certainly know with swimming, and you've even pointed this out to me in the gym, how our shoulders, the anterior musculature will be quite a bit stronger than the posterior musculature. So I think balance is probably very
Right.
important,
And that's
leading to longevity of our joints.
That's already a common issue with people in general.
more for swimmers, though.
Yeah, I mean,
So-
I imagine.
And I
That's
haven't
one of
I
the
haven't
things that we-
I haven't talked with a contemporary coach, regarding what they're doing in the weight room. If it's any different than me 40 years ago at Utah,
Right.
because back in 40 years ago we did the swim bench, basically cables, the simulated freestyle stroke, basically just getting in and bench press, pull-ups, that kind of thing.
Right.
I imagine it's quite a bit more sophisticated now.
Yeah, I would think you'd want to do more isolated shoulder work and definitely hit those rear delts to create that balance.
Yep.
Prevent injury.
That was my first thought.
Rhomboid work. you
Yeah.
know.
I think I'll hyper focus on just upper posterior instead of just all upper anterior.
And
'Cause, I mean,
then sprinting, the legs are real important too.
Yeah. Oh, yeah.
And some swimmers, I don't think I'm very good at incorporating my leg power into, the upper extremity power. I think my legs are just kind of more back there as rudders. But you watch the Olympics, recently, some of those swimmers and the wake that they put up with their legs, it's just huge.
well, that's what happens when you don't use leg drive on bench.
That's right. Yeah.
I was waiting for that.
I think we were on the same page.
Yeah. Yeah, true. Hip, huge amount of power
Yeah.
from the hip. From the,
Wait,
So-
the hips?
well, yeah, because
Yeah.
that's where the power in the legs comes.
Oh, okay, I see what you're saying.
Yeah, and the kick. Yeah, most of your power is going to come from core and hips.
Core just to get in a planking position to,
Mm-hmm.
Yeah.
I think the regulating of breathing is the most fascinating part to me. Because I just can't wrap my head around it. I just can't.
You do it when you lift,
Yeah, but I can't do it when I swim
but you do it when you lift. So why can't you do it when you swim?
because I suck at swimming.
Because you're drowning, right?
Yeah. I mean, I can swim. It's just like understanding like how to regulate when to breathe during that.
So in a sprint, probably not going to breathe at all. None. Like the 50-meter freestyle, men's or women's, Olympics.
Really?
One full length Olympic pool.
Interesting.
Usually they will not breathe one time, even though the urge is so huge to take that breath. Physiologically, you don't need the oxygen if the race is only going to be 20, 25 seconds in length. You can't, even if you were breathing the oxygen you just sucked in, you don't have the time for your muscles to utilize it. But you have that urge. The brain is telling you to breathe. You have to shut that down and say, well, you don't really need it.
Interesting.
That's really hard. Because your
muscles may not need it, but your brain does.
Yes. You're just the urge is so strong.
Yeah.
You just want to lift that head and take the breath, even though physiologically it doesn't do you any good whatsoever. Just leaves that drive from your brain telling you to breathe.
okay, it doesn't do you any good because you get that 50 meters quickly, right? But the rest of us are floundering.
That 20 seconds is now a minute and a half.
Yeah, exactly.
And halfway through, I just switched to doggy paddling.
That's right.
Yeah, so, you know, it's relative.
Uh-huh.
But I mean, I get it. Like, because with lifting, it's a lot easier to regulate breathing, but you're not. It doesn't feel like it's the aerobic aspect of it.
Right.
Like a high rep set of squats, I can hold my breath, then get a breath, hold my breath, then get a breath. But with swimming, I think it's just the aspect of your face is in the water, and then your face is out of the water.
Mm-hmm.
And I don't know, it's like my brain just has a huge disconnect between drowning and.
Yep. Well, how many reps is in a high rep squat set?
Like an actual high rep, like 20 to 30.
You're doing what? One every couple seconds?
Doing one as like pretty much as fast as I can. So probably like, yeah, at first it'd be like a second, and then it'd probably turn into 2 or 3.
Mm-hmm. Yes, you probably you'd need to breathe for that.
Mm-hmm.
It's going to take you probably 45 seconds, a minute.
Probably about a minute.
You're gonna need oxygen, I think, for your muscles to perform. Yeah, and the air you take in will be, delivered to your muscles, so it'll do them some good.
So what about longer distance swimming?
Yeah, you got to breathe. Katie Ledecky, watch her; she's breathing.
Yeah, but it's so subtle. I mean, it's so fluid.
Yeah, it doesn't seem like they're taking big breaths.
And it's just their technique is refined.
Yep, sure.
Because we're used to just like taking massive breaths and trying to like fill our bodies with air while
swimming. You don't have the time. Yep.
It's interesting.
Mm-hmm.
I can't wrap my head around it.
I was thinking about training modalities, and the Proteus would be an amazing tool for swimming.
I think there is a swimming thing on there.
Yeah, there is.
Is there?
Mm-hmm.
That's John's machines you're talking about?
No.
No, the Proteus is the machine I have in the annex.
Oh, I've seen that.
Yeah, a lot of Eric Cressy's knowledge is put into that machine. So you're doing a lot of cross-rotational, cross-plane work, right? Which we don't do typically in the gym and weightlifting, but is so important for athletics.
Yeah, haven't seen that being used yet.
We'll put you on it. For shoulder,
Mm-hmm.
be great for your shoulder.
I think
Backs, awesome on backs.
Blake's mom's been using it a
Yeah,
lot,
we got her back recovered on it.
and it's made a huge
Oh,
difference.
Shelley?
Yeah,
Mhm. Yeah.
makes a huge difference.
Yeah.
Yeah, curious to
Yeah.
check that out. Try it out.
Yeah.
I'm curious because it stacks you up against people in your similar age group and like sport. So it'll be interesting to see where you stack up against other swimmers.
Mm-hmm. Are there many other swimmers here at Iron?
Not at your level, not here. But in the program there is.
Yeah, it's
Oh.
like
So it's nationwide. I have a
Oh,
nationwide database.
That's
so
so
interesting.
it'll pull from that and tell you like your percentile with amongst other swimmers similar skill level and age.
Yeah, I don't want to be going up against Katie Ledecky. Or Caleb Dressel.
Don't worry.
They have like the 65 and older,
Right, yeah.
subset population you can compare
Like
me
I
to.
said, game of attrition, baby. Yeah, same with powerlifting.
So besides swimming, what do you do? You mentioned skiing earlier.
Yeah, it's a passion of my wife Bridget and I. We love to ski. Yeah, that's why we live here. We moved out to Reno to take advantage of the mountains. Yeah, I know Tammy's a skier. Do you ski?
No, I've snowboarded like 3 times.
Okay.
That's about it.
Mm-hmm.
Skiing, I don't think it's for me.
It's okay.
It's-
You gonna do any more boarding?
Maybe sometime in the future.
Mm-hmm.
Not right now. The hobby itself is already very expensive,
It is.
and it's just I enjoy it.
Mm-hmm.
My body doesn't, because by the end I'm just beat the hell up.
Sure.
because I'm not very good, so I'm just
we
falling on my ass, constantly hitting my face.
we would like you from the vantage point of the Reno Orthopaedic. We would like for you to go back out and snowboard.
No, it's okay.
You know, you're good for business.
See, I used to skate. Maybe I'll just go back and do that. I feel like I'm more likely to get hurt doing that.
Oh, I don't think so.
You don't think so?
Now,
No.
what do you enjoy besides the lifting? I know you're here all the time, but do you have any other passions? And
Like, no.
it's all right.
I do this,
Uh-huh.
and sometimes I like fishing or hiking or playing video games. Nothing crazy. Other sports I've never really connected with besides lifting. Just lifting, general strongman, powerlifting.
So Brandon started in strongman, right?
Yeah.
Yeah.
Now, you said something about tattoos. Had you been a tattoo artist?
No,
Okay.
I'm a terrible artist.
Same here.
Sort of. I'm more of a craftsman,
He-
That's more my style. I don't even have tattoos. I'm a pretty boring person. I'm like just obsessed with lifting.
It's okay. Nice to have, one passion.
Right.
But most people don't have any passions.
And
Yeah.
what's nice is he shares it with the members. He's an excellent coach. So that his obsession benefits us, all of us. And he's really analytical, so he has an eye, and he'll watch a lot like Bob. He'll watch someone, and he knows exactly where the weakness in their lift is stemming from, and able to program them with.
How did you learn that? How did you get that skill? To be able to look and determine.
I think it was just a lot of just over time, learning from everybody else too, reading a ton of stuff and figuring out what's best. I think when I started here, I learned a lot from Jeremy, and I also learned a lot from Blake. And then, over time you just start incorporating stuff, and it helps all of us kind of work together.
Yeah.
And so,
And that's what's nice about the team here, the coaches, is there isn't that singular ego that prevents that team concept from working.
Yeah.
And these guys, I mean, we're constantly, saying, "Hey, what do you see? What do you see? What do you see?" When we're struggling with
it
someone.
wasn't that long ago, like 3 weeks ago, I had a client in the evening and just couldn't figure out how to get his deadlift looking a little bit better. Like, I had the idea, but I just couldn't figure out, like, what was the next step. So I asked Blake, and Blake came over and watched. So did Garrett. So did 4 other people. And so there were 7 people watching him. And it just helped a lot, like, getting all the information in there. And, I have no problem asking for help if I don't know.
And a lot of times you're saying the same thing. You all 7 are saying the same thing.
Yeah.
But he's hearing it in 7 different ways, and something clicks,
Exactly.
for the athlete.
And so, I don't see any problem with asking for help or if you don't know something. And so just over time, I think I've just picked up on certain things. And part of it is probably just the obsession.
Well, and it's an eye too. I don't think everyone has that gift. There's, like I said, Bob was amazing, still is amazing. It just being able to see it.
I've always joked about how this was the only thing that made sense. Because everyone's body's different, but we all have like very similar movement patterns at the end of the day. And so piecing those puzzles together, I think that's the most fun part about coaching, is just figuring out like what's going to work for this person, what's going to work for that person.
Yeah.
It's funny how we all have our puzzles to work out.
Exactly.
Patients come to me, try to figure out, part of the fun is trying to figure out the problem. What are we going to do about it?
Right.
How are we going to fix it?
And every fracture is different. Every injury
Yeah,
is
same thing
different,
with
every
you.
joint.
So having an individual that hires you to be their coach, you got to figure out their problems and how to get it to work to optimize, their outcome.
That's the most exciting part. It's the challenge itself.
Mm-hmm. Yeah.
And I imagine of course, it's probably similar to you. It has to do with the body.
Yep.
So understanding like the way the body moves and everything is just so fascinating.
Mm-hmm.
I'm not as smart as other people, but I get the gist.
I think you're probably smarter than most people in respect to observing how somebody lifts and what you can do to improve that. Certainly a lot more knowledgeable about that than I am. Yeah, you're not going to necessarily be able to replace my knee.
Oh, absolutely.
That's okay.
I'll take a crack at it, though.
But yeah, you and I, we've been trained different ways. We
Yeah.
all have our role. Yeah.
Yeah, you stayed at a Holiday Inn last night, right?
But I mean, life is, you get puzzles and
Yeah.
you try to figure it out, how you're trained and
Yep.
what your knowledge base is. Well, a lot of things that we all do are similar in that regard.
Very.
Mm-hmm.
I think it's just trying to make a difference in people's lives, make them better, right?
Mm-hmm. Yeah.
However we can do that.
I think that's very important. Making a big difference. I love seeing people build confidence and be a lot happier, be excited about something.
I think that's why I love our nonprofit programs so much.
Yeah.
Being able to see someone who came in a year ago that was suicidal, addicted, self-medicating, ready to quit on life, and bringing them into the program and watching them change their whole life, have the confidence to make better decisions and
It's a big impact, isn't it?
love themselves a little bit more,
You can't help but feel good yourself when you see that.
Yeah.
How about Big Sam being back?
I know.
Probably
I know.
it makes me so happy. It makes you.
I almost cried talking to him.
I know.
I was like tearing up.
I know.
It's going to make you guys happy just to see him back.
Yeah.
And this is where he's decided to do it. To restart his life is here at the gym.
Yeah.
Yeah,
it's
talking to him.
It's pretty cool. That's it makes it all worth it every day, for sure.
Yeah, I love seeing stuff like that.
Yeah.
It's just,
And all I can do is encourage him. Said, yeah, Sam, you need to be here.
Yeah.
You're one of us. You're
Absolutely.
an athlete. You got to be doing this kind of thing.
Yep.
And I thank goodness he realizes that. So we can get a nice restart here.
I know. Keep him around.
I think it's also it's important for everyone to understand that everyone's welcome here.
Mm-hmm.
And I think because there's I'll hear certain stuff like clients, like newer clients that get discouraged. And I always try to reassure them, like, no, just because you're not lifting 800 pounds doesn't mean you don't belong here.
No.
That's not how this works. You definitely belong here.
Yeah. In powerlifting or a strongman, even bodybuilding, Olympic lifting, that's just, probably 1% of the population, right? That come to the gym. People from all walks of life, are training daily next to people that are affluent, and there's no difference.
That's what makes this gym special.
And you'd be surprised what you can learn from other people too.
So cool.
It's
So much
remarkable.
knowledge in there.
Yep.
Yeah. The community, the support.
Mm-hmm.
Makes it fun coming in every day.
It's pretty remarkable. I can sit and shoot the breeze with like 20-year-old
Yeah.
or an 80-year-old.
Right. Because y'all have that one common thread, right?
Yeah. You learn something from everybody.
Yep.
Yeah,
for
very
sure.
interesting place. So much better to work out here instead of in your own gym at home. I don't know how some of the people can do it just at home.
Yeah, some people can.
Yeah, not me. I have to come to a place like Iron.
Yeah,
Definitely inspires me. And
makes
what's
it a little
nice.
bit easier.
Well, and what's nice is you're never the big fish in the small pond here. There's always someone stronger and bigger and badder, right?
Yes.
Remember, you get reminded of that daily.
I always say you don't want to be the strongest guy in the gym.
No. And I start bitching and whining about something, and then I see our vet that's an amputee come in, right? And I'm like, you have two legs. Stop whining. Stop
Yes.
it. Get your head out of your ass and stop it.
Yeah,
So, it's a
Garrett
good
and Big
reminder.
Mike, those
Yeah,
guys are
yeah.
really inspirational.
Absolutely.
Think what they've been through. They're over there kicking butt.
Yes, they are.
It's really neat to,
Yeah.
very neat to see.
Yep. Good stuff. All right, Brandon.
All right. Well, thanks for coming on.
Yeah, you're
Appreciate
welcome. It's been an honor. It's actually kind of fun. Never done anything like this before.
You're a natural.
Yeah.
You're actually very
I
good.
say you have a good face for radio.
Yeah, we all do. That's why we're doing this. We all have a good face for radio.
Thanks for watching.